Hi, my name is Dr. Matthew Connor and I am a surgeon at Tallahassee Ear, Nose, and Throat. Today, we are talking about tympanoplasty and tympanomastoidectomy. First, what is the tympanic membrane and what is a tympanoplasty? The tympanic membrane is the medical term for the eardrum. The tympanic membrane is located deep in the ear canal and is attached to the hearing bones called the ossicles. It is a vitally important structure for normal hearing. The tympanic membrane vibrates in response to sound waves. This vibration of the eardrum will move the hearing bones, or ossicles, which then translates those sound waves to the inner ear, or cochlea. The inner ear processes this motion and then sends a signal through the cochlear nerve to the brain, where it is interpreted as sound. A tympanoplasty is the term used for the surgery to repair a damaged eardrum. Most commonly, the damage can be a perforation resulting from trauma, infection, or the extrusion of a surgically placed tube. Sometimes the eardrum is not perforated, but is instead retracted inwardly by negative pressure behind the eardrum, creating a very thinned out and dysfunctional eardrum that must be replaced. Either of these conditions may lead to symptomatic complaints, such as hearing loss, fullness in the ear, or dizziness. However, if the hole is fairly small, or if the pocket is fairly shallow, the patient may not have any symptoms at all. In either case, the damaged eardrum should be replaced in order to avoid further complications in the future. There are multiple materials that can be used to repair the eardrum. Temporalis fascia is commonly used, and it is located above and behind the ear. The fascia is the covering over the muscle in that area, and it is a thin fibrous layer and is very similar to the eardrum. Additional sites that are sometimes used include the tragal cartilage, which is the small projection in the ear right in front of the ear canal. Sometimes we prefer to use cartilage, particularly for the retracted pockets, in order to prevent them from recurring. The damaged eardrum can be approached from either behind the ear or through the ear canal. This is in large part determined by the severity of the damage to the drum, as well as by the location of the damage in the drum. Your surgeon will determine which approach would be best for your particular problem. After the eardrum is repaired, the middle ear and outer ear is typically filled with an antibiotic ointment or dissolvable sponge. The surgery typically works 90% of the time in repairing the damaged eardrum and correcting any associated problems such as hearing loss. There are multiple factors that determine the potential success, including the health of the rest of the eardrum surrounding the area that is being repaired, as well as any possible infection that might occur after surgery. The failure of the drum to heal does not necessarily mean that a revision procedure might fail as well, although it does make it somewhat less likely to succeed. Next, what is a tympanomastoidectomy? A tympanomastoidectomy usually includes a tympanoplasty, but in addition, this procedure involves removing abnormal or infected tissue in the bony area behind the ear, called the mastoid. This is done with the microscope and a surgical drill. The surgeon may also have to repair the tiny bones, or ossicles, in the middle ear that help with hearing. The main reason a tympanomastoidectomy is performed is for either a cholesteatoma or chronic otitis media. A cholesteatoma is a cyst of skin cells that most commonly results from chronic eustachian tube dysfunction and retraction of the eardrum. The process will injure the eardrum and may injure the hearing bones. A cholesteatoma requires a surgery to remove the cholesteatoma and repair the eardrum. Chronic otitis media is a chronic middle ear infection that persists despite antibiotics. This condition requires surgery to clear the infection. Sometimes patients who failed tympanoplasty will require tympanomastoidectomy in order to clear the infection and improve chances of success. Possible complications associated with both a tympanoplasty and a tympanomastoidectomy include a taste change from damaging the nerve that goes to the front 2/3 of the tongue on the same side as that being repaired. Frequently, this leads to a metallic type of taste that improves over a period of a few months. This does not, however, lead to a significant taste loss in most patients, as over time, this becomes something that they adjust to quite well. Additional risks include permanent damage to the hearing, which is very unlikely to occur, with an overall incidence of less than 1%. Even less likely to occur would be a damage to the balance system, leading to ongoing dizziness and imbalance. There is also a small 1% risk to the nerve that moves the face on the same side as the procedure, but this is an extremely rare complication. For patients who have a tympanomastoidectomy, there is the additional risk of injury to the lining of the brain, causing a brain fluid leak, but this is also extremely unlikely. Patients can expect the ear will be fairly sore for the first week following surgery, and that the hearing will not improve for a period of several weeks due to the packing both under the eardrum as well as on the outside of the eardrum. You may be given an antibiotic to take for the first week post-operatively, and often will be brought in to see the surgeon 1 to 2 weeks post-operatively for your first post-operative check. We hope that this video has helped you to understand the risks and benefits of tympanoplasty and tympanomastoidectomy and what to expect during your recovery. If you have any further questions or concerns, please contact our office at any time.